So warm welcome across to all the panelists. Good afternoon, friends, once again. Okay, so this session is about employee wellness, friends. What was once a segment of benefit package, employee wellness was more of something we used to offer across because we had to offer it as a part of the complement package. It's now become a non-negotiable priority for all our businesses. Okay, and the outbreak of the corona virus has expanded the scope of well-being from just physical to include mental and a lot more other facets as well. Okay, and today work, life, health, safety, well-being, and they've all become inseparable. So to this session, we'll focus across on the need of, how do we link our well-being, our work, and how can we design well-being in a manner so that it helps employees and organizations to thrive. So that's what we'll try and sort of, achieve across over the next 45 minutes with the help of my colleagues around on the stage. So the first question I have across, and Nivedita, I'll reach out to you across for this question. Okay, so Nivedita, what are you doing to drive, wellness as a culture in your organization at the individual level and at a company level?
Yeah, thank you so much inviting here, and I'm so happy to see a lot of people after maybe 1.5 years. That makes me feel good today, actually. So I must tell you, we did a lot of activity, a lot of things, but I'm going to be very precise. All of you know the workspace and the workplace has been transforming, towards a collective well-being, if I put it. Nobody is thinking what is your your medical claim and all. It has gone, it has moved, every organization has moved to a different level. I must tell you, very interesting we did. I think many of you must have heard a term called HALE. How many of you have heard of HALE? H-A-L-E. Have you heard? So we started a program which is called Health Assessment and Lifestyle Enrichment. This term, if you ask in my organization, everybody will know. What it did is, that is a proactive approach towards knowing the people's mental well-being. We started in 2021, in fact, so 20 December, and basically knowing how they are, eventually creating certain activities. I'll take you through quickly how we did it. Eventually, how to increase the productivity of the organization, because people went through, let's accept this fact, that COVID really, made all of us, each one of us have gone through some personal loss or financial loss, You ask anybody here, they will have a personal loss or financial loss. So HALE has 3 things. One is a self level, we did something, then a macro level, and there's a micro level. We did an assessment. All of us do the employee satisfaction survey, right? But here what we did is, we did a assessment on mental healthness. And from there we took out few agenda how to deal with. We also did one assessment how as an organization my leaders are feeling that they should concentrate on the mental well-being. Okay, before we came here we are discussing how the culture has changed. So we started doing a well-being culture, how do you, your values, your everything has to be connected towards well-being of people. Our organization, the average is 35-year-old people I handle, it's very difficult to deal with the mental state. They were going newly married, having kids. It's very difficult and coming to work. So this HALE model, we did self-level, we created, these assessments. Then we took out, we also saw the mediclaim, how many people are availing mediclaim and for what. We got a lot of data from there. Then at a macro level, what we did is, we started tying up with lot of other things, ambulance and hospitals, people coming, to the organization and speaking about, on mental health. And at a micro level is very important, where I said you have to start, believing in it, and entire organization should have start creating as a culture. So all the managers were groomed how to and nurtured and given lot of workshops how to deal with the youngsters and peers, because they are the one who are going to talk. Okay, somebody hasn't, is not responding in teams. Why? You might ask, switch on the video. Maybe the person doesn't have a place to, maybe the person in Bombay, operating from a kitchen. So these are very small things, but we are putting pressure on the person. Switch on your video. Calling after 9, became, the work from home became a 24 hours work for people. So we started actually educating these managers. So this hell people started really, oh, it should not be hell, So everybody was so conscious. We ran a lot of, one calendar we, actually launched. Every day, you have to show your gratitude towards someone. Tomorrow you need to say, do something. So 30 days calendar, then you get a score. How is your mental health? So managers say, no, we are fine, but actually they're not fine. So this health program really helped us to create the culture. And today I think people know what it is. Understanding their peers, bosses, even bosses also go through mental stress, right? So it helped us a lot, I must tell you.
Sure. Thank you, Nivedita. And to move ahead, actually, I'll pick up on one of the points you mentioned about mental well-being.
Yeah.
And maybe I'll reach out across to Naresh across to talk about that. So Naresh, my question to you is, what are some of the initiatives which organizations have adopted to get in a cultural change to accept discussions around mental wellness, and what role can leadership play across to destigmatize the entire discussion around mental well-being?
Hello. Is it on? Yeah.
Yes, sir.
Basically, this discussion around wellness has traditionally focused on these few areas in the employee-employer relationships sort of thing. One is they want people to be taken care of, they should be physically okay, health checkups should be done. So that whole focus has been that employee is productive to contribute to the company's this thing. So these are the visible things which so far had been taking center stage in the mind of leadership. But as the pandemic progressed, people started realizing that there are other items, other things, other issues which are affecting productivity a lot. I'm talking purely from the point of view of leadership and the employer basis. Then the focus started shifting to other than physical thing, what is troubling them. So the realization came that physical health is okay, it has been monitored, financial health has been taken care of. Two areas were missing. One is that social wellness or interconnectedness, and second was somebody to talk, somebody to confide, somebody to discuss your fears with. So that's where it started crystallizing, and then people started realizing that social connection has been lost, and the trust of the people. When you have when you're talking to people, your colleagues in the workplace, you have some good friends with whom you can confide the things which you can't share with your family also. So that connection is also lost. So that's where the realization came that mental well-being is the major reason which is there. And the signs that we started seeing in the people are universally known to everybody. The anxiety, the fear, the anger, of the helplessness, you can't do anything, your friend is sick or a relative is died. That these are all classical symptoms of PTSD, post-traumatic stress disorder. All classical thing. Only thing is what has happened is these trauma has not lasted only for a minute, like you just survived a motor accident and come out of it. It has carried on for 2 years. And the effect and the impact is going to last longer. So unless we take care of that, managers and leadership is going to be facing the problems a lot. So keeping that background in mind, what some kind of initiatives have been taken in the sense that managers talking to somebody over the phone, asking other than the work, how are you, how is your family, can we do something, are you missing something, what else you want some additional help. you want to talk to somebody, calling them to office, and then having these kind of conversations. It started helping in the sense that people started opening up. Their fears started coming out. And one thing has become very clear now, that all organizations, I'm sure, must be going through the same. And they need to have some mental health professionals working in the companies. It's no longer a job of HR or yes, manager. People have to start employing these people, because impression amongst the employees is that mental health is their own issue, and they are responsible to take care of that. There was a survey done in UK in which more than 55% of employees felt it is their own responsibility to take care of their own mental well-being. And only 2% thought it is the responsibility of the organization. Whereas organization is suffering the most in lost productivity. So they have to reverse this thing. They have to take the ownership. And many systems have been created, like, we have in armed forces buddy system, when a new person joins a company or unit or battalion or platoon, he is assigned a buddy. Buddy is a friend, who is senior to him, he is more experienced, who can guide him, who can answer his questions without going through the hierarchy. So the health buddy, we should train some people who have been sensitized on these aspects of mental health and mental well-being. And they are able to guide or counsel or talk to these people mental. Then second thing is, like Nivedita said, creating a calendar. She's talked of calendar of different activities. What the basic problem is that mental health is still, or mental wellness is still a stigma. People don't like to talk about it. They don't like to say that, okay, I'm depressed, or I'm having anxiety, or I'm suffering from hallucinations, or things like that. So if this stigma has to be taken out, this is a stigma is like, you blame somebody. It is not a lifestyle disease, that you have drunk over, have been over drinking and your liver has gone bad and you are suffering from liver cirrhosis. It's not like that. It's not your fault that you have attracted this disease. So that stigma of blaming should go. It is happening with everybody. It's irrespective whether he's drinking or not drinking. It is still affecting him. So that stigma, to take it out, that stigma, it has to be treated as normal. So coming back to the calendar, when we have a calendar, when you say, we will discuss about mental health issues, immediately people will be cautious, they'll be restricted, and they'll be guarded in the interactions. So we have mental health is included in one of the employee wellness month. Once you talk about financial wellness, 1 week, call people, give them training, ask people to come and coach them, explain them what options they have. Then second, so social wellness, interact, ask the families to come, get the families, children to interact with each other. People should have interaction other than the work also. Then you slip in this, mental wellness. There, people are getting used to that. Okay, this is whole package. It is one of the part. It is, we are discussing that. So that should also form part. I think in India, we are lacking behind US, where they have one full month as mental wellness awareness month, one full month. May month is that this thing. World Health Organization also has declared 10th October as mental wellness. We don't have any kind of awareness or, I would say, inclination. I'll be rather harsh on myself and people like us, that we don't have that real inclination of helping others. That mindset has to come. So that can only come when your productivity starts losing. You start getting the hit on that account, then only people will see. But it's heartening to know that people have started recognizing that. So this is my take on what leadership should be focusing on. And the path is very, very clear. Unless they take that, they are heading for trouble.
Thank you, Naresh. Thanks a lot, and I especially like the system of the health buddy which you mentioned. I think it's a very, very powerful thought that you left with us. Any of the other panelists across you want to share in terms of what else can be done across organizations to get more initiatives adopted around mental well-being?
I can maybe add something here.
Sure.
I don't know if my mic's working. Am I on? Yeah. Okay, great. So I think one thing that I've seen work quite successfully in a lot of the companies is definitely partnering with mental wellness institutions, offering subsidized therapy and care. And I say subsidized versus free because it takes discipline for the user to actually pay for it, also to continue using it. I think that's worked really well for many organizations where they've enabled their workforce to get the help versus trying to solve the problem completely themselves, because it's a very personal problem and there's always going to be that discomfort of being able to expose yourself from a mental health wellness perspective to your employer. And I think that's one of the initiatives of actually proactively saying, okay, fine, this is an organization or this is a therapist that we've partnered with. These are services exclusively to and confidentially to the entire employee base, and you can reach out directly and we have nothing to do with it. So the employer steps out and hands over and empowers the employee. And I think that I've seen work very, very well in a lot of organizations. So that's definitely something I would think is a good initiative to do.
Sure. So thanks Anisha. Also just to share my own experience over here, we have a helpline for our employees as well. It's a confidential helpline, where our people can call it, and we have a lot of people calling in. So I think that's something which I would encourage across all of you to look at for your respective organizations as well. Okay, so now let's move ahead across, and my next question is for Anisha. Anisha, I want to ask you, do you see financial well-being, having an impact or any correlation with mental well-being?
Okay. So I think nobody in this room will disagree that financial stress is a very real thing in the ecosystem in India and the employment workforce. I think despite that, what we see is that a lot of companies actually underestimate the degree of financial stress, right? Employees, and this comes back a little bit to my point with regard to mental wellness, are often ashamed to ask for financial help. When they do ask for financial help, it has to be for reasons justified and that are approved or in line with what the corporate is willing to approve, right? And then there's of course the whole layer of bureaucracy. You have to apply for help, go through sort of an acceptance rate, and then hopefully get accepted, right? And what I've seen is that need, right? There's the need that comes to the surface, which most HRs of big corporates are aware of, and then there's this huge latent demand, which puts a lot of stress on employees' mental well-being, right? Where they have to then go out, borrow from friends and family, they have to wave their hands in front of family members, in front of financial institutions, and that directly impacts not only their work, but also their mental health. I think one thing that we've seen as a company, we offer earned wage access and we're a financial wellness platform. We've seen more than 60% uptake in employment segments which are very high, well paid. So I'm not even talking about employment segments which are lower on the income scale, but higher employment segments as well, significant uptake. Those are, for companies that when we started off with, these were companies that were expecting maybe 2-3% uptake. And what we saw was astronomically higher, right? That in itself, and then after, of course, if we relate that back to what customers have actually called us and told us, is like, this product has saved our life. We feel empowered. We don't have to go beg our family. We don't have to, worry about this because we know we have access to it, access to our own money at any given point in time. So I feel as a company, we're obviously addressing one part of financial wellness and one aspect of it. But today I do see a lot of companies, a lot of corporates thinking about it more proactively. Being open to the idea of, let's say, an earned wage access, which, a couple of years ago they would not have been. So I do think that today more and more corporates are looking at financial wellness and financial wellness partners almost like synonymous to insurance, right? What insurance was a decade or so ago, where they do believe that this is something that's going to be the norm, and this is going to help their employees, they're going to help their mental wellness, and it directly help productivity. And we're seeing that, it's early days still in India, but we do definitely think that this is a very important, gray area or whatever you want to call it, right? A gray area which companies are still trying to figure out what is the right offering for my employee. Right? It's not as easy as, okay, fine, with mental health, you can of course partner with institutions, you can enable that support. With financial wellness, where a company is supporting that cause, you have to be very sure of what they're offering and see how it aligns with them as a company. But today that openness exists, and I see that conversation around that building up across HRs. Yeah.
Sure. So Anisha, on that, I have
Yeah.
one more question for you. Do you foresee across, you know, a maturity in this space where over a period of time, the way, you know, companies budget for, say, for example, a health insurance, which
Yeah.
is a part of people comp and ben, companies would invest money and invest for example, in subsidized loans XYZ as a part of their formal offerings, or do you think we are still some time away?
I think absolutely. Most of the companies that are very proactive on culture building, on benefits, right, for their employment workforce are already doing it. And in fact, they've been doing it for a while, right? The scale and the magnitude may not be as what you see in the Western countries, which are slightly more evolved in this regard, but India is not too far behind. So I think there are definitely companies that are much more progressive on that front, who've taken that stance and have been doing it for a while, slightly silently. And I think the conversation is shifting with companies who haven't been doing it to actually proactively do it, right? How can we make sure that my employee is never subject to loan sharks, to predatory borrowing, to high interest costs? How can I make sure that I protect him? We've had CHROs talk to us about, situations where they couldn't help. And now they're reaching out to us saying that, we need to think about this more seriously and actually offer something like that. Because it's something that existed and, they weren't necessarily having the tools to enable it. Yeah.
Great. Thanks, Anisha. Moving from, a specific topic of mental wellness and then financial wellness, we'll lead to a more generic topic now. Sumit, I'll reach out to you for this.
Sure.
Okay. Sumit, how can we create a culture shift, okay, by driving sustainable engagement, okay, to get the change in behavior in terms of, employees and thereafter a shift in, cultural, the organization's culture overall?
Right. Quite a few heavy words actually in the question. So let me try to demystify, in my own view, how I look at it. Organizational culture is built by the people, by the processes, and by what is being communicated. Very simple. So till the time people are not involved mentally, physically into what is being done, every policy practice will fall flat and the culture will go for a toss. Very simple. And I can now give certain examples that what we have done in the last 2.5 years or so. My firm, my organization being part of the great Berkshire Hathaway group, already there is a lot of focus on, strengthening the culture. We do get a lot of insights from our sister concerns across the world. One of the elements that we focused very clearly on that, mental health is a health issue. That's been, you see that written very clearly everywhere, wherever you enter our organization, that, if you have a headache, you can have a stress, both are equally important to address. You should not think that if you say, okay, I have stress, people will think you are mad. And that's what I allude to, where, there is strong stigma which is still attached. I see a lot of our human resources professionals talking about mental health. I hardly see line managers talking about it, right? Someone calls up and say, boss, today I'm feeling stressed, I'm tired. Still the line manager says, okay, by the evening, update me on how much the sales were, right? And that's a matter of fact. So leaders need to practice that. And I've seen that most of the leaders have now started initiating the conversation around how we can focus on well-being. Second element, as an organization, what we have done is to create a group of employees. They call it communities. We call them employee wellness champions. And these are the set of people who have distributed themselves into the 4 elements that has been talked about: financial wellness, physical wellness, social wellness, and mental wellness. And they keep on conducting communication sessions or activities throughout the year. Obviously, the participation is higher because it is driven by the employee. And I'm talking very basic. What is required from the HR head, from me, or from anyone, is not to talk lofty stuff. It's to just provide the budget they require. That's the important element, where the budgets will come from. And we have provided the budgets to it. Very simple, if with your permission, if I can just ask the audience 2 questions, right? When you were, you got your first job, did you invest, were you aware where you need to invest when you got your first job? The first insurance, when did you purchase? Once you were 25 or you got the first job? not a way.
Job.
Job.
Right?
Yeah.
First was job. Fact of the matter is most of the folks who are coming into the organization today, they are not even aware what it is. Just a show of hand, how many of you know the taxation laws currently? Individual taxation? 1, 2, 3, 4. Can I take a percentage? 4 on 100, 4%. That is the amount we know. Right? So we actually, it's all about knowledge. People don't know when we talk of financial wellness. Right? There are products which are coming in. People have no idea where they should invest. Either there is a herd mentality, okay, let's jump in, let's invest, or it's sort of a FOMO, fear of missing out. Oh, they have invested in, crypto, I should also invest in that. And that's what the young generation is doing. And that's where the financial wellness comes in. Our focus is more of creating knowledge around it. That, what are the what does the law says, what are the tax saving instruments, where you can invest. That's the first element. The second element, that's where a lot, how Indian economy has behaved, and one can relate it to the generations that are working are also playing in. The parents, or the background, financial background of people who have joined over the last decade or so, it is much better than the one which joined prior. Right? So the need to earn, money and save it has started reducing. Right? So they don't take, okay, the job as, okay, at the end of the month I'll be getting money. That is changing. So the communication has to be different. The set of people whom I interact at times, the young crowd which is coming in, a lot of you are parents of such people, they have significant fear of failure. Right? As soon as you give them a feedback that, okay, things are not working for you, look at them, they start shaking. And folks, it's not about one person. I'm not generalizing, but that is a matter of fact. Because they've been told getting anything below 95% in class 12th, you are a failure. I have to tell them 100 times, right, that I got 76% in my class 12, though it was 1996. It was allowed by my father at that time as well. Now it is not allowed. So these are certain elements which we look at from a practical purpose. I've told the teams very clearly whenever I've spoken, do two things, do it well, so that they are impactful and they live their life. The culture builds from practice, communication, and how we are delivering on the results. The way you mentioned, we have a helpline. We established it when the wave 1 hit us, with partnership with ICAS, and that during wave 2, they received close to 20 calls a day. And it is allowed for our employees, their spouses, anyone, their family members can call up. I will get to know, I'm the only nodal person for them, my position. Only get to know if someone is showing a suicidal tendency, otherwise we don't get to know what has happened. But I get to know the number of calls which have happened, the generic report that comes to us. That has been very, very important. It is important that we streamline, the mental health issue very clearly. That's what my view is.
Sure. Thank you, Sumit. Thanks for sharing your thoughts. Now we'll move across to, managing across medical conditions of our employees. And you'll reach across to, Nivedita and Naresh, both of you, to sort of share your thoughts with us. So my question is, how can we segregate health risks of our employees, and how can we then work upon them on a personal level where required? And are there any avenues across available where we can get this going?
Yeah, I think this is an excellent question, because as you're saying, people get confused. I'll give an example. One of the lady colleague actually didn't come to office. I asked what happened. She said, I'm having a terrible toothache. So one day it happened, after 1 month, again some forum, some meeting, again she was not there. I called up, I said, where are you? He said, my toothache is just not going. Believe me, I gave my doctor's thing, you go there and check. She came back, he says, no, the tooth problem is not going. There's a health issue, right? But you'll be surprised, after 4-5 months, even I forgot. I used to see her, how is your, you're fine. Even she didn't tell me 2-3 times. How many times she'll tell me I'm having a toothache? This lady suffered for 5 months with a toothache, and some root canal also happened with her. Some doctors, she went to multiple dentists. At the end, actually the crux is, she went to a dentist. The dentist said, when did you start this toothache? She says, I had in the month of September. I still remember this. He said, where did it happen? No, I had gone to US to drop my son, and after that, and he started in US. When I was leaving, he said, is it your, how many children you have? So I have only one son, 18-year-old, I dropped him. You know something? It was actually stress. It was not toothache. How do you segregate this thing? You know what, she came and told me, Nivedita, can you believe I didn't have a toothache? And the doctor said, do you get a migraine when you have stress? Do you get a headache when you get stress? Why will not get toothache? Even for me, it was a knowledge. Many of us actually we put together, we don't know what mental state we are. The doctor said, you don't have anything, take few sleeping pills and do meditation. That doctor didn't do, I wish I can take his name because I started going to him after that. I realized he must be the best dentist in the country who could speak, you know. But you know, coming back to your question, it's very difficult. So your organization should also know what they're dealing with people, what kind of people they're dealing with. I spoke about this assessment we did rather. I think with a proper interval, do an assessment of your organization. You know, you have surveys, trust me, it will tell you, are you ready to address? And I took a little, you know, leverage with this lady. I said, do you think in a town hall you can come and speak? Okay. So she was absolutely fine to, you know, speak. You know what communication Sumit told? I think the most important thing is that what we did is we made, you know, last year we discontinued with this activity thinking that, you know, people are fine now, but that's not true. We for a year, every month once, okay, we used to have a town hall and it used to be virtual, so across Middle East and India we could do this. People will talk about their issues. I lost my father, I lost my you know, father-in-law, I lost my, you know, uncle. It became such a habit, people started speaking their own personal issues and very open. I think it was I think I created a lot of bonding when I was doing these sessions. Believe me, slowly it happened like that. So people, you know, left their meetings because this was voluntary. I said it has to be like that. You know, we have one HR person and business person, I told them as a project, do it, if it happens, happens good. So the business had started saying that, you know, you have to do it at 8:30 so that we start the day. I said, no, this is what you need to learn. Accept that this is an issue. What organization readiness, you know, it's important. How much importance, he spoke about a budget, right? How important it is for you. Trust me, this creates, if your organization, you don't create, like I spoke to you, how we, you know, our managers, we really took them to training programs, how to deal with issues. These are the mid-level managers, actually has a lot of importance in the organization. At a senior level, we talk about strategy, but these guys are important for you. We realize this level needs to be trained, need to know what is the mental, you know, well-being. And as a culture, if you run it, your readiness comes automatically.
Nivedita, carrying on from where you mentioned that these people started talking about their problems. In psychology, there's a term called catharsis. Okay, catharsis is like, you know, doing something, engaging in some activity to take out your own repressed guilt, anxiety and all. This is what happened. This is one of the ways people help externalize and vocalize their own fears. And when they interact with others, others listen to them, they feel that I'm not alone. Because somebody who's not spoken, but he hears somebody else. That, yeah, I am not alone. It is happening with him also. It is not something abnormal. So this is one of the ways the catharsis happens. Another way is like in psychodrama where you role play of a hurt husband, terminated employee. So you end up taking out your own repressed feelings and anxieties. And once that starts happening, you start making the bonds. With then you are able to share more freely and more confidently, and that helps. De-risking the health issue with companies' other aspects of functioning happens that way. Like, you know, when people are able to talk, then this issue becomes handled at their own level without you having to step in necessarily, other than maybe providing infrastructure and time and freedom to them. So.
Sure. So thanks, Nivedita. Thank you, Naresh. I'll just add one more perspective on how we can segregate health risk of employees. Okay. So one more approach which we can possibly add across is actually using a health score. Like in our organization, we use something called as a Wellbeing score. So most of us, we have access across to claims data of our employees. We all invest across in health checkups. Okay. Maybe if we employ the right side of partner stroke vendors, we get data across on from variable device to trackers, XYZ, people's activity, sleep, etc., etc. Okay. So I think all this put together can culminate across into a health score.
Yeah, true.
And what we do across is, we give every employee a well-being score, as we call it, and then we tell it, this is your well-being score and this is your potential. Okay, and this is where you compare to your peers. And then we work across with the individual in terms of telling them, if you want to go from your well-being score to your potential, these are the areas where you need to work on. So it's worked well for us. Okay, we are still doing the journey in terms of, how do we take every employee on a very personalized journey. I mean, we started with a generic journey, obviously one shoe doesn't fit all. Then we moved across to a cohort-based journey, and now we are moving across to a more personalized journey. But that's been my experience, and I just thought I'll share that across with the audience as well. Okay.
In fact, just to what Sumit said, they have that call, right? But all of us have signed up with that. Some point of time, owning it up, that whole thing, that people are calling up. What he said, he knows that how many. Sometimes we say no, that's very personal. Somehow I feel we should know. Maybe not the details. How many people are calling up every month to this phone? Somebody has to, today's day, maybe 2 years back would not have gone through that. It has helped us actually. What we did, we started getting data, how many people are calling up. You'll be surprised the number of calls in 2020, it increased. We had this one-on-one help for pata nahi how many years with us. We didn't do it now. We had it from, so many years back. Nobody, one call. When we started monitoring 2020 by October, every month, we used to have some, 45 to 50 calls, which is your health of the organization is so bad, you can make out. It's difficult, you can't enter there, right? It's a one-on-one call, and they are, and we also tied up with an NGO who can counsel them. But we thought how to deal with that number. Believe me, the leadership team sat down, they said, no, this has to be dealt. So we segregated the lot into financials came actually. Lot came, very sorry to say, the relationship between the family, husband, wife, brother and sister. I saw few families breaking down, trust me, during this pandemic. So we tried to see how we can put I think that data is so important to know. But you can't really deal with it. There's so many personal things, right? But it scares you as a leader of the organization, it really scares you. And I feel genuinely if you want to do something, feel for the person. It's not a tick mark, I got a score, I signed up with a counselor. Genuinely some team has to work, and it has to be from different departments. Create that council, well-being council in the organization. Let's not do a tick mark work. Moodometer, how we feel today, yes, I feel great. Is that the right thing to do? I feel genuinely that council helps, I feel.
Sure. Thanks. Thank you, Nivedita. Just the last question. I'm sorry, ma'am, you were asking me to finish off, but this is a very relevant question.
Did I speak more?
So, and this is for Sumit. Yeah. Today's the world of digital. Okay, and Sumit, I want to understand from you, how can we leverage tools and technology to drive health and wellness digitally?
Right. So before I respond to this, let me just give a short clarification on the helpline that we have. Mental health as a concept works on empowering people.
Yeah.
So we track We are happy with the fact that the usage is going up, that people are speaking.
No,
And
that's
if they
actually
need,
not,
if they
yeah.
need help, they'll
Yeah.
come to us. That's the principle we
True,
use.
true.
Now, it's a very important and pertinent question these days, because you will see a lot of apps, lot of products in the market which are actually enabling people to track their wellness, to set up their targets, to do it on an individual basis. How an organization can help is a multi-million-dollar question right now, because with the advent of challenges in cyber security and data related laws that are going to come up. There is a data related, we don't have it in India, but it is under active consideration right now, which will come up. It will play a significant role in how an organization will behave. Now, one of the challenges, for example, that we face very clearly, that there are a lot of apps, we are not sure who will get hand on the data, what kind of encryption that is required, what kind of information that will go. Do I need to take permission from the employee? Today, you are using an app on your own mobile, right? You are giving the permission. It's not us. There is a situation where right now we are fighting a battle amongst ourselves, discussing right now whether we should allow these apps on our official phones until and unless we have signed up.
True.
Right? Because these are devices managed by the organization. How will we be taken? Will we be sued? In India, still no one is suing, but in other parts of the world, yes. So, great apps, great usage. From an organization perspective, I think the apps or the products or the tools needs to tick mark the cybersecurity very clearly. Then only they would be adopted.
And
that's how I'm looking at it.
They should be aware of the privacy laws which are coming
Absolutely.
in.
So,
Great.
thank you, Sumit. Thank you, Naresh. Audience, I hope this has been an insightful session for all of you. So, thank you for your time. And Sumit, Naresh, Anisha, Nivedita, thank you so much.
Thank you.
Thanks a lot.
Thank you so much.
you.
Thank you.
Thank you.